Hello, everybody. How are we doing today? I'm Julie, and this is Crystal.
Hi.
And we are coming to you here today because November marks the beginning of Pulmonary Hypertension Awareness Month. So, I'm sure not a lot of people really know what that means, but we are here to tell you all about it. During these videos, we will kind of discuss what pulmonary hypertension is and how Crystal and I have come to meet each other. And you're going to learn a lot about our lives and how similar and how different we are.
You're going to come exercise with us, too.
Fun. So, we'll start off with what is pulmonary hypertension. Pulmonary hypertension is high blood pressure in your lungs. So, what that means is it makes it hard for your heart to pump blood from the heart to the lungs and then to get pumped through the rest of your body, because the rest of your body needs oxygen in order for it to function. So for us, and I guess I should say we both have pulmonary hypertension,
Yes.
just different causes. So what that means to us is we get short of breath very easily.
A lot.
And some more than others. There are a lot of different causes of this, and we're both go to show that there's different causes.
Different causes, and there's different groups. And I have no idea what group I'm in just because I've dealt with this my entire life, and a lot of what I've been learning has been new from other people. So I didn't even know there were different groups. So I'm learning as I go, and I've dealt with this for 37 years. So I don't know.
We'll get back to that a little bit later. But what some people might get confused is it's not regular high blood pressure. It's not when you go to the doctor and you're being diagnosed with hypertension. It is because that is systemic or your whole body. So when you take our blood pressure with a blood pressure cuff, it's actually kind of low. So Crystal, what's your
96
average?
over 70 something.
Yeah.
So
what's
low.
the reaction that you get?
Your blood pressure's really low. And I'm like, yeah, it's fine.
Whatever.
It's normal for me.
And then for me, I think my highest is usually like 120 over 80, which is normal, or 80-ish. But I do get as low as, 97 over like 68 or 70.
Yeah.
So we have high pressure in our lungs, not the rest of our body.
We have really low oxygen levels. That is what they really panic over.
Yes.
So some people aren't as low as others. My oxygen saturation on a good day is maybe 90. I usually live somewhere between 80 and 85. On a really bad day, I can go as low as like 75.
Now, is that resting, or are you moving? Or
No, that's usually resting.
Resting.
But here's the funny thing. I've been as low as 50, and everybody wants to throw me in a trauma bay at that point, but no, I'm good. And a lot of times I don't realize that I'm that low because, again, I've lived with it forever. So it's just normal for me. And I can kind of tell some days if I'm having a good day, and other days I feel like I'm having a great day and I'm good. But medications, which we'll get to in a later video, have helped tremendously for me.
Yeah. And my oxygen stats are actually usually within normal. So probably about 95, 96 or plus. Sometimes it's a little low, 93. I just went to the doctor the other day and it was 93. And she's like, oh, it's getting a little low. I'm like, yeah, whatever. But I'm sure when I exercise, it drops down lower and I just don't know it.
We're going to find out in a couple weeks, actually.
I'm scared.
You guys are going to find out with us. So, Julie, let's talk about how each of us were diagnosed and how we met. Do you want to talk about how we met first?
What do you think?
Yeah.
Sure.
All right. So, basically, I said earlier that I've grown with this illness. They found it when I was 2 years old. So, I was born with a congenital heart defect, and they found the pulmonary hypertension later on, which was directly related to the heart condition. So I had always told my doctors I've never met anybody else with my condition, and they were telling me, oh, they're out there, there's more people with this condition, and I'd never met anybody. I finally met someone about 10 years ago at a doctor's appointment, and I lost touch with her. I didn't really talk to her much. But one day I was at Ohio State University, which is where we go to see our lovely Dr. Daniels, who is the best ever. And I was sitting in the waiting room, and I saw this beautiful face sitting there. And I was like, excuse me, I don't mean to be rude. Why are you here?
Pretty much.
And she told me I have pulmonary hypertension. And I was like, no way, me too. Like, I should have been shocked, right? I was at the doctor with her, anyway.
Yeah, but we go to the doctor and there's so many different ages of people there. There's
could have been anything.
Old, young, and we're usually one of the younger ones.
Yeah.
And then we got to talking and sharing stories because, sometimes you wait forever, and which is fine.
Yes.
I would wait all day for that man.
Me too.
So,
yep, me too.
I would sleep in that lobby overnight for him.
Yes.
Not in a weird way, though, I promise.
He's good looking, but he's old. Just kidding, Dr. D. Promise.
Where was I? Oh, yeah. So we were sharing stories, and then I asked her where she lived. And I'm originally from Dayton, moved to Mansfield for my job about 8 years ago. And she said, Shelby. And in my head, I was thinking there's no way it could be Shelby, as in, like, Mansfield Shelby. And so I asked her, close to Mansfield? And she said, yeah. And I was like, that's crazy, because I live in Mansfield. Who would have thought that you meet somebody with a rare disease that you have
60 miles away.
And, yeah, you're at an hour away from home.
On the same day.
And then you end up living in the same city.
Yes.
What are the odds? So, yeah.
It was meant to be. Match made in heaven.
PH sisters.
Yeah, that's what we called ourselves for a really long time. Do you remember that?
Mm-hmm. And I mentioned that it's rare. So this is about 1 to 2 in every million. I actually looked that up earlier. Yeah.
Oh.
So we're pretty rare. We're awesome. And they like to call us zebras.
They do.
So,
why do they call us zebras?
Because, is it in medicine? You don't forget to look for the zebras because they're rare.
Yes.
Well, they always say, don't go looking for zebras.
Yeah.
When you have a horse.
Yeah. So basically, we're so rare that sometimes we get missed. And like I said, I had never met anybody with this condition for 30 some years, and knowing that there were other people out there was actually kind of a relief to me. But yet it kind of made me feel sad because I know what I go through, and I hate that other people are going through it too. But we want this month to, we get our own month finally. Oh my gosh. But we want to raise awareness and talk about it, get people talking about it. There's no known cure. Basically, there's medications that help us get through our daily lives. Some of us have better lives than others. Some of us are able to be more active than others. And we will go into that in some future videos. But anyway, so Julie, how were you diagnosed?
So I was diagnosed, and I've been asking around because I honestly suck at dates and history and like my past. And I come to the conclusion I was diagnosed when I was about 20, so that was about 13 years ago. And for my entire life, I was the opposite of Crystal. I was healthy as can be. I went to the doctor maybe once a year for strep throat. That was it. And I was active in gymnastics, bowling, color guard, winter guard.
You were a bowler? Mm-hmm. Were you good?
Yeah. For my age. I'm still pretty good.
We should go bowling.
Yeah.
If we can breathe.
So, and then at that time, I was running, jogging around the neighborhood, doing pretty much everything that most normal young adults do. And then I just remember one time I couldn't make it up my street without stopping because I was severely out of breath. And then I couldn't make it to the other corner because I had to stop at the other corner because I was severely out of breath. And I remember thinking, man, this is just weird. Why can't I run? And then I think the guy I was dating at the time and I were walking around the neighborhood, and there was this really big hill. Can't see my arm, but it was this big.
It was really big.
And I remember getting to the top of it and feeling so out of breath and panicked that I just started crying because I couldn't breathe. And then it's like I'm upset, and then I'm crying, and then I can't breathe because I'm upset and crying. It was just like a weird cycle. So then, that all kind of led to me going to my primary care doctor. And actually, I was going for menstrual irregularities because I just thought, hey, these are supposed to be regular, they're not. What's going on? And then we tried different things, and it still wasn't regular. And I finally was, said, I'm kind of more worried about seeing stars and blacking out. And then my doctor was like, what?
That is kind of a
That
concern.
shouldn't be happening. But at that time, I was working as a nursing assistant, so I would bend down, stand up, and then it would start to black out, or I'd see stars and would have to lean against the wall, or else I would feel like I was going to pass out. So then she ordered an echo, which showed irregularities, and then she sent me to a cardiologist. I had a heart cath done, and I was diagnosed pretty quickly, I feel like. But yeah, they always told me it was damage left behind by a virus, because you always wonder, like, why?
What caused this?
Yeah, why now? And I do remember specifically, so that was all being diagnosed in the summer. That spring, I came down with this horrible stomach virus to where I went to the ER. They did the typical supportive measurements with fluids and you'll be fine, just give it time. Which is the truth, I was fine. But I was vomiting like crazy, like a true stomach virus. And then that summer is when I started having all my breathing problems. So I kind of, to this day, think it was left over from that stomach virus. So
I never realized that was one of the reasons. That's very interesting.
Well, I mean, that's what idiopathic.
Right.
I
I just didn't realize that. Yeah.
Yeah.
True. There are so many different causes for this. And again, I didn't ever know that. Like, the only thing that I ever knew was I was born with it and it caused damage.
She was born like this.
I was born like this. That's
Wait, what's that
terrible.
commercial? Maybe it's Maybelline.
Maybe she's born with it. Maybe it's
Maybe it's
Maybelline.
She was born
Definitely
with
was not born with Maybelline. Blue makeup, yes. So I never realized, since I was born with a heart condition and developed the pulmonary hypertension, I thought that was the only cause for it. So I never realized that, diet drugs caused it. That was probably the first cause that I knew outside of my own that could cause this. And then now I'm seeing there are so many other things like lupus and all kinds of autoimmune stuff. Like, there's a lot of things that actually cause pulmonary hypertension, and there are some things that people have no clue. And so yours is kind of one of those things where you're like,
and they've done all the blood tests for lupus, rheumatoid, what's the other, scleroderma, all those autoimmune diseases.
Yep.
And those are so far negative, so I'm still that primary. Yeah.
So you already kind of have heard a little bit of my story, but mine goes back to when I was a little 2-year-old. I was at a babysitter's house. My mom was working, and I apparently had a cold or something, and I was coughing, and the babysitter called my mom at work, and she's like, this baby's turning blue, you've got to come. So they took me to the emergency room, and they diagnosed me with pneumonia. Well, I almost died. Because it wasn't pneumonia, but they didn't really know what it was. So they sent me to, it was then just called Columbus Children's Hospital. It's now Nationwide Children's in Columbus. And they did a lot of workups. And they first thought that I had cystic fibrosis. I was very tiny. It was very hard for me to suck. I couldn't breathe. They just couldn't figure out what was going on with me. And then this amazing woman came in. Her name was Dr. Cranen, and when I think about this woman, she's still alive to this day, and she's probably like 180 years old. I don't know. She's really old, but she was amazing, and I remember her. She kind of reminded me of Albert Einstein. Like, her hair was like white and kind of crazy. She was so sweet. She was actually the genius that kind of diagnosed me with this, and
So you were diagnosed at 2?
Yes. So I was
I
diagnosed
thought you were
at 2.
diagnosed later on in life.
No, so I was diagnosed at 2. And then when they tried to figure out, because at first it was just kind of the heart thing, and then they realized the damage to my lungs had been done. And then when they did further research and looked into it, did the heart cath and that kind of stuff, they figured out that my whole my aorta, all of my vessels are completely different than everybody else's. So that's kind of a whole other story. But the pulmonary hypertension is basically what the problem is with me not being able to breathe. And I have a VSD, which is basically a hole in my ventricles, the lower chamber of my heart. So my blood just kind of goes back and forth between that hole and doesn't fully get oxygenated. So in turn, again, my pressures are up in my lungs. So that's pretty much how I was diagnosed. I've lived with this my entire life. And I think next time we will talk about some of our challenges that we've gone through with this disease, because it's not fun. We try to have fun with it because, what else are you going to do?
Can't do anything else.
We got to have fun with it. We got to be clowns sometimes so that we can get through this. But anyways, anything else you want to say?
Do we want to talk about medications?
Oh, yeah. Let's talk about our meds really quick.
Okay.
What meds are you on?
Can
I borrow some of yours?
Sure.
I was here the other day and I forgot to take my meds in the morning before I came. And she's like, do you want some of mine? I was like, oh, yeah, we are on the same ones.
So, just like we said, everybody is different. Everybody's causes are different. So mine is not known. Hers, is from congenital heart defects. So the way we're treated is differently. So for me, I take an oral pill called Opsumit, OPSUMIT. And what that does, well, pretty much all of the medications I take works to dilate the vessels. Yeah, there's
I can't see it.
dilate the vessels. So that way there's easier flow of blood through the vessels.
And your heart doesn't have to work as hard.
And your heart doesn't have to work as hard, exactly. So without the medications, they're like really tight, and then the right side of your heart gets really large because it is a muscle. Mm-hmm. And just like with any muscles that you work, you do bicep curls, you're going to get bigger muscles. But with the heart, when it enlarges just like regular muscle, that's not good.
No.
It's just not good for your heart.
Nobody thinks that's pretty.
So what our medications do is to help expand the vessel. So I'm on an oral medication, which I started off with an oral medication, a different one that I'm on now. And that worked maybe for a couple months. And then it just progressed so rapidly that I was again, in college, walking around the campus. Thanks.
That's why I didn't go to college, because I couldn't walk around the campus.
And I would be on level ground and would still have to stop maybe 3 times before I would even get to my class. I would tell my friends, don't wait on me, just go ahead. I'll be late. I don't care.
Were you embarrassed?
A little bit.
I was so embarrassed when I had to tell my friends,
not too much.
Without me. Oh, I was
but
embarrassed.
But I think they all kind of understood at that time.
Yeah.
So then I went back and got a right heart cath again. And that showed that my pulmonary pressures were still up. And I functionally was not doing very well. I would pass out going up steps and just really couldn't do anything, just sleeping all the time. So they told me that I needed a pump, which at the age of 20, I was mortified. I woke up and got back to my room and they said, yeah, we're going to need to put you on this pump. So what that means is I have an IV site right there that goes straight into my superior vena cava, right? Yeah. Mm-hmm. And you can see, and you can see it's you can see the tube a little right there that's tunneled underneath the skin. You can feel it.
Oh, you can.
Yeah, it's kind of cool. I'm a freak in nature.
We both are.
So, and here's my pump. Right there. So what this does is infuses medicine into me 24/7. This stays on me all the time. Never comes off. And this is a medicine that needs to be infusing all the time, or else I could decline, get some pulmonary edema, and just bad stuff happens, and then I can't breathe. So that's about all I take.
What? I started on a medication. It wasn't until I was 21. I was actually, I declined pretty rapidly. It was kind of a steady decline. But when I got into like my 19, 20, 21-year-old ages, I started to decline pretty rapidly, and they actually put me on a heart-lung transplant list at the very top because I was so sick. And so I happened to ask a doctor, is there a medication I can try? And they're like, you know what? We think your disease is too far progressed. I don't think it's going to work, but if this is what you really want to do, we'll try it. I'm really glad I asked because the first medication they started me on was called Triclear, which is about $3,000 a month or so. These medications that we're on are insane, you guys. So I started on that medication, and within about 6 months, I felt so much better. I was on oxygen 24/7 prior to starting it. I was off the oxygen. I went to nursing school. I was doing really, really well. It was the best I'd ever felt in my life. And I lived in California at the time, and so the weather had a lot to do with how I was feeling as well. But then I moved home about 3 years after starting the medication. I went to my last doctor's appointment there, and they're like, hey, guess what? You don't meet transplant criteria anymore. You're done. So I was like, celebration, seriously.
Yeah,
it was so exciting.
Awesome.
So I came off of the list and never got the transplant. And then when I got back to Ohio, about 6 months after that, I started to kind of feel kind of crummy again. I was working at Cleveland Clinic, and the job was pretty taxing. And they started me on what was called Revatio, which is sildenafil, which is also Viagra. Yeah,
It does have the same effect.
We don't let our husbands and boyfriends take those. Don't worry, we hide them. And I'm still on that one actually.
I started off on that.
You did?
Yeah. I actually went through Viagra and Cialis.
Oh, you did Cialis too?
Mm-hmm.
She's really good there.
And then...
Yeah. My doctor literally told me, make sure your husband doesn't get a hold of these. I'm not kidding. So and like Julie said, it basically increases the blood flow because these vessels are able to dilate. But anyways, so I was doing really well on that, and then I started to kind of feel crummy again, and so they started me on an inhaler. The first one was Ventavis, which was horrible. I was working in the emergency room at the time. The treatments took a really long time. The medicines to mix, it was kind of a pain. So then they switched me from that to Tyvaso, which is what I'm currently on now, which is, again, a lifesaver. It really gives me that, like, oomph I need to get through. That one is about $30,000 a month. And what is yours?
I don't know the monthly, but I know my pump medication is about $175,000 a year.
Yeah. It's Remodulin, right?
Yeah, Remodulin.
So there's Remodulin, and then there's Flolan.
Flolan. Yeah.
Flolan.
Almost said
Yeah.
Flolan.
Flolan. Flolan. Those are the two, like, major IV meds. And they're kind of really scary. I won't go into the whole story now, but I actually did go against medical advice, and I got pregnant. And so I was on Remodulin for a short time. And it's a legit drug. Like, it really does make you feel better, but there are, pluses and minuses that come with it, which you can talk about at a later time.
Yeah.
But, so these medications are insanely expensive. And I think that's something we kind of should talk about in one of the videos, because I know that many medications, we're dealing with the EpiPen and insulin now. Like, we've got to get some sort of, like, medication reform or something going on, because people can't afford their medications, and that's ridiculous. Like, we need this stuff to survive. So, anyways.
And I just want to say, being told I need to be on a pump was traumatizing, and I hated it. I probably went through years of resenting having to mix my medicine every other day and switch out my syringe, because that meant that I had to plan ahead, which at that time and age, I was young and just flying by the seat of my pants.
You had stuff to do.
Yeah.
More important.
Yeah. And so that meant that I had to think before I left, do I need to mix tonight? And I still do this to this day. Do I need to mix tonight? If I do, am I going to be home in time? Sometimes I'm like, that can be a good excuse to go home because I have to mix.
Have you ever run out?
Yeah.
Oh, me too. That was bad.
Yeah. Well, sometimes you can't hear the pump.
I know.
And you just start feeling, for me, when I run out, I'm like, I feel like my whole face is being drained of, like, the blood's just being drained from my head. Thanks. And I feel tingly. So, but I have to...
It's not the wine.
I'm sure. I have to make sure that, I have my supplies with me if I need to mix while I'm out, or pre-mix. But I resented it for a long time. And I finally, in the past, I would say 6 years maybe, have been okay with it. And it's just my daily life. And sometimes it's frustrating when I'm laying in bed and I'm like, I hear the pump go off. I have to get up and mix. Why? But then I just get up and do it. But I love my pump. I think that's what I was getting to. And it makes me a functional person. It makes me be able to walk, even maybe doing some mild hiking. I can do yoga. I can exercise. I can work. I can pretty much do, I feel like a normal person on my pump. So I would not give it up for the world.
I hated the pump. I was only on it short term. Hated it. I wanted it off like pronto. So I'm not on it anymore. And again, we can go into all that later. But yeah.
I think that's enough for this time. What do you think?
Right. I think we're good.
Okay.
All right, guys. So we will see you next time. And we're not sure what we're going to talk about, but we're going to get through a lot of stuff. So thanks so much for watching. See ya.